Patient Source is our clinician-designed, web-based, highly customizable electronic medical record solution. It comes with full ePrescribing, medicines administration, and medicine stock management for inpatients and outpatients. Here's how you can prescribe and dispense medications to outpatients, all while having your stock tracked. As with all Patient Source demos, all patients are fictional. Acute and repeat prescriptions can be created for patients to take away from your hospital or to collect from an external pharmacy. It is powered by a fully customizable formulary. Your pharmacists can configure which type of medications are available to prescribe, which preparations of medications are available for dispensing, what dose checking limits to trigger alerts on, how much of each stock of each medication preparation to hold, and what the drug-drug interaction rules are. You can see the history of medications prescribed on an outpatient basis to a patient. It is filterable by acute and repeats, and also by dispensing status. Prescribers are able to prescribe by searching for medications. You can choose whether they are limited to formulary items or not. Suitable doses are suggested, and these are based on safe dosing guidelines and available strengths. Routes of administration are customizable, and complex day patterns are supported. Quantity suggestions are also available based on pack sizes in stock. You can mandate that certain types of medications are prescribed by brand only, such as might be the case for anti-epileptic and anti-Parkinson's medications. Repeats are supported, where you can pre-authorize a certain number of issues. You can also set review dates. Prescriptions are always automatically checked against a patient's allergies. They're also checked against other medications that the patient may be on. Interaction checking is smart. It can identify when you're prescribing a medication that's of the same class as another medication that the patient has an allergy to. It can also cope with spelling mistakes, and the dose, route, frequency are automatically checked for safety too. Prescribers can choose to override these warnings and prescribe anyway, but they must supply a reason, and this reason is visible for audit purposes and also visible to dispensing pharmacists. Prescription order sets can be configured to conveniently and consistently prescribe protocolized treatment. Prescribers can customize the items should there be a clinical need to do so. And each medication in an order set is individually subjected to the same interaction and safety checks as before, but with the power for the prescriber to override. Medication can be issued to your internal pharmacy electronically for direct dispensing, and it will land on the dispensing work list. Medications can be sent electronically to external pharmacies, where they will receive both a human-readable and a cryptographically verifiable version of the prescription. Finally, prescriptions can be printed out and handed to the patient. This gives you a backwards-compatible mechanism for patients to obtain their medications from pharmacies that don't have electronic prescribing. Patient Source includes a powerful pharmacy module to manage your medication stock and to run safe dispensing. You can see a work list of all the medications awaiting making up, checking, and collection. Clicking on a row allows you to see the requested prescriptions and the statuses. A dispensing technician can select a prescription to prepare. They can select each medication to be dispensed, and they will see the different medications you currently hold in stock. Patient Source will automatically suggest the oldest non-expired batch to pick from, which helps you minimize medication waste and costs. They can then pick the appropriate box from the medication shelves. If there are problems with a prescription or stock issues, they can indicate so. Once ready, the made-up bag of medication can be pushed onto a pharmacist for checking. Once items have been picked, the bag labels and medication box labels become available for printing at this time. A pharmacist can compare the batch that is in the bag to the batch that was picked. They can also amend the prescription label and add visual identification information. Should there be a problem with the medication, a pharmacist can indicate the issue and push it back to the dispensing technician. Otherwise, it can be approved for dispensing. When a patient or carer is ready to collect their medication, or the medication is ready to be posted, it can be marked as dispensed. Stock can be managed using the Patient Source Pharmacy module. You can configure multiple stock rooms such as central and satellite pharmacies and ward drug cupboards. You can interrogate specific medications, and you can update quantities or add new batches here. Barcode scanning is supported where compatible scanners are available. You can configure a minimum stock you wish to hold of each medication and then run reports against your stock to see which medication has low stock. This helps you avoid over-ordering medication and avoid running out. You can then generate orders from wholesalers for medications to restock. Patient Source is a powerful outpatient e-prescribing, medicines dispensing and pharmacy stock control solution. Chief pharmacists can configure the formula of medications that are stocked and available to prescribers. Prescribers can prescribe medications and order sets, seeing in real time what's permitted and what's in stock. Dose and quantity suggestions help ensure prescriptions match the preparations and packs available. Prescriptions are automatically checked for interactions and dose safety, and prescriptions can be issued to internal pharmacies, electronically to external pharmacies, and also printed for backwards compatibility. Full pharmacy dispensing workflow is supported with making up, checking, and dispensing stages, with tracking of batches and stock levels. Stock can be closely managed to minimize wastage and to avoid running out. Patient Source, complete outpatient prescribing and pharmacy management. Patient Source, patient care safely in one place.